It's so great to see everyone here. And can I just say, when I was diagnosed with Chiari 7 years ago, I didn't know anyone. So today's like a really big day, like having this community and feeling like I have a little bit of support and we're all in this together. And so I feel really grateful. I was diagnosed with Chiari and a couple of other multiple illnesses that I'll share with you. 7 years ago, I started with my first symptoms of Chiari with what came on as a migraine that lasted for 5 days. And it was with vomiting, unfortunately, and it was very severe and it would not go away despite any medication that I was taking. And I kept debating it off, thinking that maybe it was stress or something was new. It was my first migraine in my life. But on day 5, I started noticing that my face was going numb and different parts of my limbs and my arms and my legs were going numb. And I felt super slow, but I didn't know if that was because of the migraine or other symptoms. So my husband at the time was deployed, and so I went into the ER. And when I was there, they ended up giving me a spinal tap. And when they gave me the spinal tap, and that time that diagnosis was not available. They didn't know what was wrong. But when they gave me the spinal tap, the next day when I came back from the ER, I started exhibiting symptoms of an ataxic gait. My leg was starting to drag on the right hand side. I was walking into walls. I would pick up, like I thought that I was picking up dishes, but I couldn't get my mind to connect to my body. So I could visually think in my head to pick up dishes from the cabinet, but I couldn't, what I thought I was doing was not what I was doing. It was frightening. And when I went back to the hospital, that's when they thought maybe it was MS. So they repeated my MRIs, etc. I was at a very small military hospital in El Paso, Texas then. And I think that really had to do a lot with being a smaller hospital. They just didn't have the experience with Chiari. It was months later, they were thinking I had Guillain-Barré, they were thinking MS. They were going everywhere trying to figure out what was wrong with me, because what was most concerning was my gait. After my gait started going away, I started stuttering. And I haven't met many Chiarians who started losing their speech. And for me, I can't describe to you what that was like. When I started losing my speech was when I was officially admitted to the hospital. And at that point, I was truly unable to walk. I could see in my head how I was supposed to take the steps in my body, but I could not get my body to take the steps. I could see words like chair, but I could not say it. I would stutter the words out. And so they ended up sending me to the Mayo Clinic in Arizona. And it was the Mayo Clinic in Arizona, when they repeated my MRIs, that found the Chiari. And at that point was when they said, we need to go ahead and do your brain decompression surgery, but we don't offer that. Barrows does. And I started doing my own research, and I found the Chiari Institute in Great Neck, New York, with Dr. Harold Rickate, who was world-renowned Chiari surgeon at the time. And he had a more available schedule. He was able to get me in sooner. So I actually flew from Texas to Arizona and Mayo, Arizona to New York. And it was at that time he said, yes, you need to go ahead and have the surgery. I concur, I agree. And, but I had to be put on a waiting list. So I went back home to Texas, still exhibiting all of those symptoms. And unfortunately, it took a couple of months to get the scheduled surgery. And by that time, I had started losing my bowels. And what ended up happening that we figured out with Dr. Rickate is that over that time lapse of misdiagnosis, it ended up tethered my spinal cord. So I ended up having brain decompression, the Arnold Chiari brain decompression surgery with tethered spinal cord surgery simultaneously at the same time. And then I went through PT to relearn how to walk and talk again. One of my tips that I share with my clients is, for me, that was absolutely profound. If any of you are having those difficulties with gait abnormalities or balance, is water. I did a lot of water therapy, and it was the one thing that I have without a doubt that helped me regain my strength. And the reasoning for that was when I was in the water, I had no fear of falling. I had no fear of injuring myself. My body was more easily able to move in the water and more freely. And the unfortunate side is that it would cause and bring on more fatigue, and it would exacerbate those symptoms. So then my symptoms would get worse. Over time in that year is what I was learning was through PT, the more I exacerbated my fatigue, the worse my symptoms became. So the stuttering would get worse, the gait would get worse, my thought process, the memory, it would be like brain fog, trying to focus a conversation, absolutely impossible. And then during that year, going through physical therapy, trying to understand what was going on with my body, was very grueling. I felt so alone. And I didn't have a forum like this. There was nothing available that I ever found in research that was a family, a community to help guide me. All I had was Dr. Ricade. It was a really lonely, long, dark, hard time. And then 13 months later, exactly to the date of my brain decompression and tethered spinal cord surgery, I was diagnosed at 38 with aggressive HER2 positive breast cancer. And at that time, with that diagnosis, I felt the lump. And my doctor at the time was saying, you're 38, you're not 40. No need to do a mammogram. Let's wait a couple of months. But I had been complaining since that summer to my PCM that I was really fatigued. I felt like I had the flu and I just couldn't figure it out. And I knew in my gut that something was wrong. So when I felt the lump, I just had an intuition that something wasn't right. And so long story short, they did the first biopsy and I was to go in. They did find that it was cancerous. They were going to give me a lumpectomy. Once again, I was at a small hospital, the same small hospital. And it was at that time that the light bulb kind of went off, like, you probably should go get a second opinion again. You learned by getting your second opinion at the Mayo Clinic, Christine. Let's go back and get a second opinion again. And I'm so grateful that I did, because I did end up going to MD Anderson and Cancer Treatment Center. And I just went to go see if they agreed with the treatment plan and the diagnosis. And I'm so grateful I did, because the first day that I did, they repeated my ultrasound and they found the second tumor that was closer to the chest wall. It was at that time that they made the decision that within those next few days, because I was traveling, I would undergo the mastectomy, and I decided to elect to have a double mastectomy. A few weeks later, during that recovery, I started my chemotherapy treatment, and I was advised that they wanted me to do 6 rounds of the HER2 positive TCH regimen for the chemotherapy. When I went through the first round, I had already been diagnosed with neuropathy from the Arnold Chiari and tethered spinal cord. And that was a problem that I was already exhibiting, but I didn't have burning pain. But when I underwent the first chemotherapy treatment, I actually ended up getting the burning neuropathy pain. I don't know if any of you guys have neuropathy, but it is an intense burning pain. I also lost all my hair on the very first treatment. And they were saying that it was going to be like the 3rd or 4th round that I would probably lose my hair a little bit later. Those 2 symptoms hitting me so quickly within the first treatment was my red flag that I had done something too much for my body and I needed to try and find another treatment alternative. And so it was really challenging to tell my oncologist at that time that thank you, but no thank you. I'm no longer going to continue the chemotherapy. I'm going to go on some different paths and give it a try. It was not advised. I was only 38. It's an aggressive cancer. I had no family history. We cannot figure out why I was the epitome of health before, why it occurred. But I made the choice of what my intuition was telling me. And from that step forward, was when I started doing a lot of research on recovery to health and how to help heal my body. I had been a fitness professional for years prior. And at this time, it's well over 12 years. But I knew I had to take a different approach to recovery. I had already been through so much trauma before, and what I was doing was not working. It was inhibiting me and not helping me. So the first tools that I used was The Truth About Cancer. It's a documentary series where they travel around the world and they look at different approaches to holistic health and treatment plans from various places around the world. And it's just looking at what are people doing elsewhere outside of our country. I started doing a lot of research on that. I started changing my diet, and then I integrated some holistic approaches. But before I mention what those are, going back, during my recovery from that first treatment of the chemotherapy, I started having some really serious gut health issues. I was in a lot of pain. We couldn't figure it out. There was bleeding. They thought that I had maybe spread to colon cancer, so they were doing screenings. Turned out it was completely fine. 2 years later, I started losing an excessive amount of weight. I lost like 12 pounds. And for me, that's a lot. Every time I was eating, I felt in pain. My brain fog was coming back again. My foot drop was coming back with fatigue. And long story short, we thought maybe the cancer was coming back because my cervical lymph nodes was swelling. And so my oncologist was trying to pinpoint, has the cancer returned? And of course, we didn't see anything. I had alopecia areata, is what it was diagnosed at the time. And then within like less than a year, all of a sudden, instead of losing all that weight, I started gaining weight, and my stomach was completely distended. It was at that time I was in so much pain, and we knew something was wrong. The doctors here on island were going to give me IVIG immunotherapy treatment in the chemotherapy room weekly. It's very intensive, and I didn't feel comfortable doing that, not having a diagnosis. So once again, I advocated for my health, went back to the Mayo Clinic in Rochester, and within the first visit, after evaluating and confirming that the cancer had not returned and doing a thorough evaluation, he sent me to the neurologist, and he was like, "It's celiac. I have no doubt with your symptoms that it's celiac." And I did not believe him, but I gave the diet a shot. I was naive. I'm not going to lie. I thought it was going to be super easy because I was the epitome of health and a very clean diet before. But it wasn't easy. However, with that diagnosis, it saved me because Mayo Clinic is the one who triggered me to understand, or taught me to understand that what they're learning through their research is anyone who has undergone surgery, trauma on the body, can often, that triggers. I had to change all of my diets. And that's when I really started changing my foods along with my approaches to recovery of health holistically. And so many of you may be thinking, okay, so Christine, what did you do to get to feeling better? What did you do? The first, it may sound a little cloy. I had been practicing yoga for well over 12 years at that time. And I found during the brain, Chiari, and tethered spinal cord, when I could not walk, when I was unable to do things that were within my normal life, yoga, yin yoga specifically, where you hold the poses for 1 to 3 minutes, was something that was very calming for my body because I was exhibiting a lot of anxiety because no one was really understanding what was going on. And then the recovery was so, so difficult. Yin yoga was really a big part of my recovery. The other was meditation. I had not been practicing that the years prior, along with breath work, specifically Kundalini. I really found that meditation, daily meditation, and Kundalini breath work helped me again, like the Yin yoga, during those moments of high stress or frustration or just disappointment. It helped me to calm my body's system down. And then from there, I would manifest. And manifestation for me, I'll show you, I have 2 photos here. They're very old because they're like 7 years old. I had about 7 or 8 of them. And my manifestation, one of my other holistic approaches, was I cut out pictures from magazines, and each picture had an emotional attachment to me. This one was, I just wanted to be able to go to the grocery store independently on my own and be able to go through the whole grocery store and walk normally without people staring at me because my gait was so abnormal. This one, I just wanted to feel strong again. I wanted to be able to work out again. I wanted to be able to move freely without thinking of every step that I needed to do. And so what I would do is I would manifest. We have a mountain here on Oahu, if you want to look it up. It's called Coco Head, and it has over 1,000 steps. And it was one of my favorite workouts before getting ill. And I would use it to go work out and climb the top of the mountain. And I would take my clients up there once a week. And it really had an emotional value to me because my clients and I would all go together, and it was very empowering to see their progress during that time of how fast they could get up and how much they had overcome. And I wanted to be able to go up Coco Head again. So every day I would manifest being able to go up Coco Head. For me, it came from a place of hope. It wasn't I wouldn't say in the beginning I necessarily believed in it. Where it honestly, genuinely came from is I wanted to never, ever forget what it felt like to be strong and what my body used to feel like. For me, I had a fear that if I forgot what it felt like to be the old original me, how was I going to get back there? So manifesting what was so important to me, and for me, that was Coco Head, was insurmountable. I wouldn't say that I believed that it would happen. I just had hope. And I didn't have hope for years. So it was really important to me. And I will say that exactly 70 years ago, this October, when it was 6 years post-diagnosis of breast cancer, 7 years post-diagnosis of Arnold Chiari and tethered spinal cord, I went back up Coco Head Mountain. I didn't do my exact workout time, but my legs were strong. I made it to the top, and it was amazing. And I will tell you now, it was the best day of my entire life, even the birth of my children, which I love. But it was because it really held value of the power of the mind over the body. And that was one of the lessons I learned. The power of the mind over the body, positive thoughts, gratitude, don't give up, have hope. My other holistic approaches were changing my foods. So after being diagnosed with celiac disease almost 2 years ago, I knew that my body was the autoimmune system was out of whack, losing my hair, losing the weight, gaining an insurmountable amount of weight, being in severe pain, the neuropathy, the foot drop, the constant fatigue, the brain fog, all these things my body was fighting. And so I knew I had no other choice but to listen to the doctors and say, okay, they're not asking me to do anything invasive. They're just asking me to change my lifestyle. So I completely cut out all dairy and all gluten. And when I say that, that means like
The shampoos, no. Facial products, no. I use like coconut oil. Skincare, toothpaste, soy sauce, ketchup. I mean, you name it. Everything has gluten. So I literally, I'm not being facetious when I say, eat 10 to 12 processed foods in my entire diet. The rest is produce. That's it. But that alone has equally helped heal my body. I cannot tell you. I feel like I did when I was in my 20s, just changing my diet. It was amazing. The first symptom that went away was migraines. I had no more migraines again. Second symptom was the bloating completely went away. My stomach pains, I started being able to eat again. And the first thought that I had was, I don't feel sick. And when that continued on, I never realized how much I was associating food with pain because the symptoms would come on so quickly. The brain fog went away. Everything went away. My neuropathy is fine now. When I had a diagnosis of neuropathy and now nothing. I have feeling and my nerves, the way the body heals is absolutely outstanding. My nerves have rejuvenated, rejuvenated, but they have healed. I can feel almost all areas in my body now where I wasn't able to before. So I had no other choice because of all the trauma that my body had experienced. And because I recognized that what I was doing for treatment was not working. And I had no other choice but to research and learn and try other approaches. That is where I am. That's how I am where I am today. It was lonely. It was frightening. I never want to go back to that place. I can't tell you what it's like to not be able to walk and talk and be able to communicate. I also, the other approach that I did holistically, it's a little personal, but it's something that I really offer to my clients and encourage them to do as well, is emotional healing. If you've had any trauma through childhood or adulthood, if there's emotional wounds that you're holding on to, is to find the therapist that you trust. And that was a big issue for me, was trust, was finding that therapist with trust and opening up and releasing those wounds and understanding why you are where you are and letting them go. Not meaning forget them, but let them go. Take the boulders out of the backpack. Backpack doesn't have to be so heavy. I know that that has had a big part in my healing as well. I'm a big believer in the mind over the body because of Coco Head. I'm a big believer in emotional healing. I wouldn't be surprised if that's what caused some of my cancer. It is a holistic approach. It is a mind, body, spirit approach if you want to truly heal. And what do I do professionally now? Well, I'm still a personal trainer. I train virtually nationwide. And then I also train at UFC gym. And I also work as an independent health advocate. And I created my own business called Hawaii Health Advocate. And I work nationwide, but I also work here on island. And I created it because I felt so alone and no one there to help me navigate the healthcare system, to help teach me how to advocate and say, without fear, I don't want to do this treatment plan. I want to try something else. Or I want a second opinion. Thank you, but no thank you. It took me through therapy to learn how to discover my voice. And that is something that I try to teach to my clients. All those tools of navigating the healthcare system to get your second opinions faster, to take some of that stress off when you're scheduling appointments, you're taking notes, you're sharing your tips with your family of what your updates are with your care. allowing me to take some of that on for my clients so they have time to heal. They don't have to do a full-time job of being a patient. And it's been very rewarding. So while those years were really dark and really, really hard and challenging and painful and grueling, I wouldn't take them back because I truly live with more gratitude today and more awareness of the current moment and having that peace. And I didn't have that before. I was always living in the past or living in the future. And I learned to just enjoy the moment. And it's all we really have.